Welcome to the Education Forum. So in today's episode, we bring you the release of the final results of the Uganda Allied Health Examination Board. And here are some of the briefs on the key points to be addressed. Now, there is an increase on the number of candidates that sat for the examination this year compared to the previous academic year, 2019-2021. And the most interesting of it all is the increase on the number of female candidates from 37% to 39%. Also, Jesse Muyingo, the State Minister for Higher Education, emphasizes equal opportunity and equitable access to education and skills development for all Ugandans. Besides that, out of 7,175 students that sat for the examination, 79% passed, with the females performing better than the males, though the majority were the males, which is very interesting because the minister says that this adds on the health workforces on the existing workers in the health sector. My name is Amuge Victoria, and you are welcome to the Education Forum, a show that digests the trends and development in the education sector. Stay tuned. But first, before I go any further, let's engage the Executive Secretary of this institution to tell us more about the background and history of this place. Let's start our first conversation today with Joseph Agondua, the Executive Secretary for the Uganda Allied Health Examination Board. Welcome to the show.
Thank you.
So every institution has a history or background, and I'm very sure this one as well has one. So what is the history of this institution, when it was established, why it was established?
Thank you. Before the establishment of Uganda Allied Health Examinations Board, the Allied Health programs were running individual examinations. Each school or a group of people would conduct their own examinations. So it was not a centralized system. It was not a national examinations. And the people observed that there were irregularities in streamlining these assessments. Then the idea was, why don't we centralize these examinations so that we can streamline and effectively coordinate these examinations. That's how the idea of establishing UAHEB was conceived. In 2009, there was a statute which was developed to establish this board, the UAHEB statute. And that statute originated from the BTVET Act. So in 2009, the board was inaugurated. And I remember very well the launching it took place in Fairway Hotel with most of the big dignitaries and stakeholders. Now, the issue was, when we started the examination, it wasn't conceived where this board would be located. That was the first challenge. The board members were elected, the secretariat staff were put in place. Then the question was, where are they going to sit? So the first thing the Ministry of Education and Sports did was to allocate us some place within the ministry headquarters, together with the Uganda Nurses and Midwifery Examination Body together. But the place was so small that it was very inconvenient to the two boards, until the first chairperson of the board was called Dr. Wilson Rwandembo, who by then was a principal in Mulago Paramedical Schools. So he said, you people, why are you stranded? I can give you space at Mulago. So that's how the board is now located from ministry headquarters to Mulago. And of course, it wasn't convenient for us to have an examination center in a school, because the inconveniences are there, irregularities are there. We opted to get out of Mulago. Then we came to some place in Tinda, Arch Apartments, not Arch Apartments, and then we started renting. We stayed there for some 2 years or so. Then we realized that it was not a convenient place for us. Then from there we relocated to Matters Way, now at Tinda here near UNEB. And that's where we started operating for some time. When the board realized that we were paying a lot of money for renting premises, like about 13 million per month, they said, supposing we saved this money, which we are paying as rent, can't we acquire our own plot and start a construction? That exactly happened. The board approved it, and then we came and secured this place here in Chambogo, Kisonson College Zone. It used to be a hostel for Chambogo University. The proprietor was somebody, an individual. He was willing, in fact, was willing to give the place to us, so we bought that place. It was a building, a hostel, but when we wanted to renovate those old buildings to become our board offices, our engineers from Ministry of Works and Ministry of Education said, no, this does not fit the standard of a good building. Demolish. So we now had to demolish the whole building, and we started from the foundation. And the work started slowly by slowly. And by the way, by the time we came in here, it was not even completed. We did it the way many Ugandans do. You finish when you're in the house. But over time, we were able to complete it, as you can see. And everybody is very proud about it. People who don't know the journey we took to reach where we are, they just come and say, congratulations, wonderful, and so on. As you heard the minister congratulating us. Yeah. It took a lot of pain for us to reach where we are. Now, what happened is that because we had prioritized construction, we stopped recruitment of staff. So we put all our resources into the construction. And that, of course, costed us a lot, because then we had very few people who were working at the center. As of now, we have had only 6 examination officers for the whole board, only 6. Except recently, the board has approved the recruitment of some 3, so that will boost our number. In total, we are 27 staff of this place, the entire staff, both technical and non-technical. So this is the situation that we came through. Now our priority now is improving the human resource. We think we are going to recruit more staff. Our staff ceiling for this place was around 46, but I told you we are at 27. So we have been operating at a very low level. But the question has been, how have we been managing? If you have such very few handful people working on the examinations, were we ensuring quality? Was anything useful being done? What the board resolved was that despite the fact that we have very few staff, let's engage staff from the health facilities. So we started getting people from hospitals, other health facilities, training schools. We involved them in our examination process. So in fact, when you come here during the time of preparing exams, like we are about to start in the next 2 weeks for the November series of exams, you will get very many people here. Sometimes we have to run workshops to set examinations. And we use a big number of people for marking. We use a big number of people to do practical assessment. So we have been relying on those human resources at our facilities out there. However, it's not enough for us to rely on those external people. There must be core staff here who should be having details into the quality of preparing examinations. That's why we're advocating for more staff. I know, save for a situation of maybe a merger, we think that we would be heading to where we are able to get the right number of staff. So basically, that is the background I've given you about your help. You know the story, how it started. Yeah. And many people were not happy when it started. They were resisting it. The people of clinical medicine and community health would say, no, we have our examination board. The lab would say, we have ours. environmental health, they will have ours. So you saw those DC coordinated. They had a coordinated business. Those small boards were running was not good for us. Now, since centralization, everything is now okay. We are using the same curriculum. Doesn't matter who you are. Whether you are trained your lab in West Nile, whether in Kisoro, whether in the central here, you must use the same curriculum. And it's the curriculum that we assess. And then we are able to regulate standards because we developed the examination rules and regulations. And that is what we are using. And when you had that people who contravened the rules of examinations for your help, they were being punished to some extent by cancelling their results. But the beauty about our counseling results is not like in other places. When they cancel your result, you are thrown away. No, we don't throw them away. We give them opportunity to come back. And I think we assume they become reformed people. And they concentrate, and they pass well. By the way, in the long run, they even perform very well when they qualify to go to the field. So that is the essence about students whose results have been cancelled. They are not just thrown away.
So Joseph, speaking of allied health, somebody watching may not understand. Not everybody understands what allied health is. Now, before we could go any further, maybe you could explain to the viewers what allied health is exactly.
Thank you. This is a question people have asked very many times, and it's good you have even brought it out. We, in the health sector, we have three categories of people. We have the nurses. I think everybody knows who the nurses are, whether a midwife, an enrolled nurse, a registered nurse, all those categories are called the nurses. And those ones actually have their own assessment board called UNIMEB. Then we have the doctors and dentists. They have their own council also. Those are another category of people. They are called the doctors. So whether a dental doctor, whether doctor for surgery and medicine, they have that category. But there are many people who are doing a lot of work at our health facilities. They are not nurses, they are not doctors. Now, you get people like laboratory technologists and laboratory technicians. They are not nurses, they are not doctors. These are the people who are going to examine, do diagnostic activities in the health facilities, like taking blood smear for malaria and so on, main tests. So those are not nurses, they are not doctors. We have a category of people, radiographers. You find these people who are doing X-ray. They are not doctors and they are not nurses. Okay. And we have, like we told you today, we have 28 programs. Each of the 28 programs is a health cadre. So you can talk of health inspectors, health assistants, they are now called environmental health officers. Then you can talk of physiotherapists. I'm sure you meet the physiotherapists, there are quite many. They train in Mulago and they have other places. Orthopedic medicine, those who deal with the bones. There are those who deal with the fractures and so on. There are those of orthopedic technology who deal with making artificial limbs. Those are allied. So really, if I wanted to explain to you all of them, I will be going through the 28 programs and what is the title for each of that program. And those are the people we are calling allied health. Yeah. Previously, they used to be called paramedicals. So allied health is just a new nomenclature that came into being. Okay. But paramedicals, I think, you used to hear of it.
Well, also the minister was very pleased and applauded the institution for the good work they have done. And also he went ahead and mentioned the good relationship that you have with the parliament, which has of course led to some of the development you have here. So what are some other partners that you have for the smooth running of this institution? There must be other partners you work with aside the government.
Well, before I even mention other stakeholders, let me applaud and appreciate our relationship with the Committee of Parliament. And the first time they visited us here, they came 30 in a number. You can imagine any one team committee of parliament to visit you. They were 30, and they came on ground to do situation analysis. How is this agency operating? What are its strengths? What are the weaknesses? Which areas of support do they need? And in fact, from that discussion, they were able to make recommendations and lobby for us for more funding. That's why this building you are seeing, they have a lot of contribution into it. They lobbied for that money. And then also, they lobbied for vehicles for us. In fact, through parliamentary committee, we allocated money to buy 3 brand new vehicles. In fact, anytime they will be here, you'll be surprised. Okay. So whereas other people are crying no vehicles, we are going to get 3 brand new vehicles. And then they also provided us a heavy-duty printer. We used to have a challenge of printing exams. We had a small one which could not catch up with the number. And we used to go to UNEB. And the challenge was UNEB would also have its examination, so you go into the queue, so you cannot prioritize your own exams. But now we have been able to procure a very powerful printer which can print, which can fold the papers, which can staple. So it is no longer a challenge for us. And that came through our relationship, good relationship with the parliament. But of course, our mother ministry, Ministry of Education and Sports, there is quite a lot of support. The major funding for these organizations comes through the ministry. And for that matter, I would like to appreciate the management of the ministry, especially Mama. She has been very concerned. But even when you think of a small agency like ours, Mama knows about it. She even talks about it. So I think everybody in the ministry, including the PS and other technical people, they have been giving us financial support and the technical support. And when we are doing things, our immediate line department is health education and training. They are the first people to run to us, and they are the ones who run to first. Then we can connect to other higher levels. Apart from the ministry itself, then we have stakeholders outside the ministry. We do quite a lot of work with the Ministry of Health. You remember we talked about the training of competence-based curriculum, where these people must go to the hospitals, they must go to the health facilities, because that is Ministry of Health Facilities, not education. If health said, no, we don't want your people here in the hospital, where would they train? And even in the first place, where would we assess them on those practical competencies? So we collaborate very, very well with the Ministry of Health. And of course, there is the council from the ministry that deals directly with us. That is the Allied Health Professionals Council. Now, when we have finished a session like today of releasing results, the next thing we are going to do, we shall combine the list of all the successful candidates and present to Allied Health Professional Council. It is the council which is now going to register them for practicing license. Until when you get that practicing license from Allied Health Professional, you cannot be employed. So it is a requirement. I think you even heard the minister emphasizing that they should go and register with Allied Health Professional Council so that they can start working. Now we have our sister examination boards. We have 4 examination boards in Uganda. We have UNEB, which is our mother examination board, and it is the one which meant that those of us who came on later. So there is the UBTEB, Uganda Business Technical Examinations Board, then Uganda Nurses and Midwifery Examination Board. So there is a lot we do together. We consult, we benchmark. So we don't have a gap in terms of working together. And even what we do today, when we are planning a program to go and supervise examinations, when the UNMEB is not conducting exams, we also incorporate their staff to participate in the supervision. And similarly, they do the same. They also involve us to participate in their examination activities. Right. And then the last and the most important stakeholders, of course, are the institutions. We have both government and private institutions. We have private proprietors, we have government, public institutions, and those are the people we deal on day-to-day basis, monitoring the training process, asking questions, how are things going in the schools. We go to supervise the training as well. How are they doing? And the principals, their registrars, and even the students, everybody has a role to play in this. So we're really very, very grateful that we have a large number of stakeholders that we deal with. Okay. These are local, but we also have international stakeholders. UAHEB is a member to 2 important international assessment boards, assessment associations. We have educational assessment for Africa, so we're a member. There is also international assessment for examinations, so we're also a member. So locally and internationally we are known, and for those international organizations we go for conferences and other interactions every year. So we are part of them, they know us, we know them.
To what extent does examining the allied health workers impact on health delivery?
Very great. First of all, I more or less try to outline what they do. They participate in curative services. They provide curative services. I am sure you know those who do clinical medicine. The people, when they come out, they are called clinical officers. But during my time, when I was a young man, they used to be called medical assistants. Those are the people next to the doctors in terms of hierarchy in providing services. They provide curative services. Then we also have diagnostic services. These are the people who will find out what could be, like for lab. They will take the blood, they will take his stool, they will take other samples. They will be able to help the doctor to make a proper diagnosis. And then radiography, they are going to do X-ray to see what is in your chest. They are going to do scanning. And they are very, very critical. You can't, certain medical conditions, without diagnostic measures, you cannot detect. You can't tell what it is. But because the machine can show what is inside you, the doctor can make a precise diagnosis. Then we have the promotive, like the health assistants, health inspectors, those going to the communities to sensitize them about the general hygiene, general housing conditions, good feeding, and you know all those. That is health education. That's the major thing they do. But we also have those who render rehabilitative services. Rehabilitative is when you have been sick, you are at the verge of recovering, and you still need some support. You may find, for example, if somebody has got a stroke, and where do they go? They go to the physiotherapy. The physiotherapy will try to take them through exercises to reactivate the functions of their muscles and so on. Then we have occupational therapy. These are people who will guide us. When you are sitting in your office, your chair must be of this position. If you sit like this, you are going to develop a back problem. So really, I can say, all of them play a very, very critical role in all those categories of services. So you can see how critical they are. Yeah.
All right, so joining me on the show right now is the chairperson for the Uganda Allied Health Examination Board, that is Nasali Rose Mugumisiriza. Welcome to the show.
Thank you so much, Vicky. Thank you for inviting me for this show.
Thank you for coming around.
You're welcome.
So, Rose, the minister was so pleased and happy with the development of this place, especially the infrastructure development. So what are some of the future plans for the future, for further development of this place, and what points need some kind of improvement?
We are really excited that our mother ministry is happy with us, and allow me to take this moment to thank the ministry for injecting funds into this infrastructure. The board had to prioritize physical infrastructure first, and we are happy we have gone this far. This infrastructure is about to be commissioned in the shortest time possible, and it will house the offices of Uganda Allied Health Examination Board. However, as the question goes, how are we planning to make sure that we have future plans for this infrastructure? We have a budget for equipping this facility so that it can be able to run national exams. And in so doing, there's a lot of equipment that is required to be put in place so that this facility can be of better use to the country. And so what has been done, it has been taken as a priority in the budget. And we want to thank the Committee of Parliament, Education Committee of Education and Sports Parliamentary Committee, that prioritized our needs and requested government also to take on this priority. And we believe with more support from government, a lot of infrastructure will come up. And as we move on into the future, we are sure that the ministry has embarked on supporting the board so that it can be able to produce quality exams, not only for this nation, but also for the region.
All right, and also, what are some of the departments in this institution, and what does it take for a school to be accredited by the examination board?
The examination board gives an accredited examination center. So what does it take? One, the school should have a license from Ministry of Education and Sports. And thereafter, the board and the secretariat will move to that school and inspect it and verify it so that it can ascertain whether it is able to have students do exams in that center. So what does it take? It looks at the personnel, the human resource that is training the students. Do they have the skills lab that matches the number that has been given on the license? And then, do they have the infrastructure to manage the examinations? And once we feel they are satisfied, they have the teaching and learning materials, then we can give them an accredited examination center.
Okay, and also about 7,185 students.
75 students.
Yeah, 75 students qualified for the examination, right?
True.
But also there are those that were caught malpracticing, about 9.
Yeah.
Yes. So in your future plans, how do you plan on making sure that this practice declines?
Oh, this first and foremost, we condemn the practice. However, it's a multi-sectoral approach. One, every time we release exams, we go and give feedback to the various centers. And centers that are involved in this practice, we go on even to talk to the students, to ask them where could their worries be so that they can get into issues of examination malpractice. We talk to the trainers, and as I've said, it's multi-sectoral, and as much as possible we want also to engage. Now we want to move on and also talk to the guardians and parents, because you find that some students have grown up in this vice right from the lower levels, and they don't feel confident that they are ready for exams. However, even when we, like we have said, when we tell them to go back and do the exams, they come back with better grades when they have not even cheated. It's just they need to be assured that they are able to perform. I think they still come with this fear that sciences are very hard. But we have encouraged them, and we want them to have a lot of practice, as we have stated. The more they have the competencies with them, the more they will feel confident in the what? In their examination.
Right. Also speaking about sciences being very hard, the students having that spirit of sciences being very hard, there seems to be a drop in the performance by 0.8%. Why is this the case?
No, probably this drop this time round was because the students had limited time in the training facilities. If we can recall very well, during the lockdown, accessibility to the health training facilities was limited. We had fears from health trainers who are the mentors and the preceptors and the supervisors of the students to be on the ward. And then the patients also didn't want to, were not in the wards and in the training facilities. So it was very difficult for them actually to practice to the maximum. But I believe they will continue to improve now that things have eased. We are praying that Ebola does not escalate and it is contained. I believe our students will be able to get the hands-on skills. However, we also want to encourage the trainers to be more keen with the logbooks. The logbooks are our practical books that that help the students in their training in the practicum areas.
Yeah, and also the commissioner spoke about the logbooks being inadequate, and then some practical equipments in the skills laboratories being few. So how is this situation going to be sorted?
This actually, with inspections that are going on and the Ministry of Education supervising the institutions, I believe it can be, the infrastructure can be improved in the training institutions, but also we want to thank the ministry. Of recent, it has come in to equip institutions with training materials. We are extremely very grateful because they have taken it up as a priority. And now with the competence-based curriculum, where 75% of the training should be hands-on, I believe students are becoming will become more confident.
Okay,
and this
that's
issue
good.
of examination malpractice.
Good news. All right, thank you very much, Dolores.
Thank you so much.
It was nice having you on the show.
Wow, thank you. And thank you for inviting us and for the interest in Uganda Allied Health Examination Board.
Thank you too.
Welcome.
On the set with me right now is the Commissioner for Health, Education and Training, who is Dr. Safina Kisu Musene, joining us on the show. Welcome.
Thank you very much, Victoria.
It's nice to have you on the show.
Thank you.
Okay, so in regards to your speech today, there are a number of points that I noted, but first and foremost, we are going to start with the results approval. We talked about results approval. How are the results approval being conducted exactly?
Okay. Thank you very much, Victoria, and I want to thank UBC for giving us this opportunity to talk to the public about examinations in the health sector. The process of releasing the result, I want to say that while we are educating health professionals, we have various stages that we manage. We have the health training institutions where education takes place. We have the examination boards that are responsible for assessment and examinations. Then we have the ministry that is responsible for supervision, coordination, and regulation. Now, by the time the exams reach release, it means that the students who are taught in the schools, in the institutions, and were presented for examinations to the examination board, and they sat the exams, and they were marked, and they were discussed, and then the results were compiled, and then they were passed. So the examination board, when it reaches the stage that exams are ready for the students to pick, it is the mandate of the minister to pass them over to the public, and that's what we are doing today. And for that note, I want to thank the examination board that has done this job very well.
And also during the speech, I noticed something about 75% of the students that were cleared to do the examinations. So what process do you follow to make sure that these students qualify for the exams? Because it seems to be like the number of students that sat for the examination was higher, but the ones that qualified and passed was low.
Okay, there were over 20,000 students that did the exams for students who are already still in the institution on training. About 7,000 of students that sat for final examinations. But those ones that passed for exams, it was about 79% of them that passed. Those ones that are now ready to go to the professional council and be licensed to practice their professions, to the 79. That means that the 21% or barely 20% that did not go through have not been denied an opportunity of doing an exam. They were given an opportunity of doing exams, but they didn't satisfy the requirement of that exams. So they will go back, in the language of UAHEB, they are called probation or pass or retakes. They are going back to their institutions and they will take those courses that they did not pass well. And when they pass well, then they will be sent off the public practice. No. So the 79% are the ones that have been successful in this examination.
And also apart from considering the attendance, the 75% attendance in class, are there other requirements that you look at for these students to qualify to get through the examinations?
I want to say that training a health worker and treating people is something of special attention. Right from the time the trainees are recruited for training, there are criteria that are considered. For example, there are programs that will look into your physical fitness, mental fitness. For all health professions, they must be mentally fit to manage. Then the physical fitness and then the academic fitness. So there are those subjects that we look for, like major sciences and biology not being omitted, and chemistry, that the students must do at O level and A level for them to qualify to be admitted into these institutions. Then during training, there is a curriculum that guides their training, and their training is in two ways. They are trained in the classroom, in the skills laboratory, and in the hospitals or in the laboratories if they are laboratory technicians and so on. So before they go to the real schools for practice, within the school we have a facility where they are taken through on dummies of what they are going to do on the patients. That is meant for them not to make grave mistakes on the real patients and on real material, for like if it is blood and so on. So the teachers will confirm that they are okay at that stage. They are ready to touch a patient, they are ready to touch a material. Then that's when they will be taken into the real world. And in the real world, again, they are taken through various steps on how to manage such scenarios. In practice, we provide the documents, and the documents that we provide we have the curriculum document that details the competences that we want the students to do. We also provide the trainer's manual that details what the tutor is going to do. And then we provide the students with what we call the student logbook or assessment tool. That document, the students document all the skills that is supposed to do under the supervision of a qualified person. And then the qualified person confirms by signing against the skill that has been acquired and say it is okay. And then that's when it is presented at the school, and that's when it is presented at the examination. So passing exam does not mean sitting in the examination room and you get 80%. It means you have satisfied the requirement, 75 attendance. You have satisfied the requirements of the clinical attachment. You have satisfied the requirement of content coverage, and then you have passed the final exams. And the board keep on monitoring them every 6 months. They are monitored every 6 months, and their performance is compiled until the end.
And also one of the key points that I noted is that majority of the students that do the diploma programs are the males compared to the female. So we find the female doing more of the clinical and community program, nutrition program. Why is this the case?
It is just an attitude issue that we have to work on, and that's why the ministry is now coming up with a policy of inclusive education, and that's why we have been having the affirmative action. That sometimes people feel that doing medicine maybe it is more for men than women. Doing nursing is mainly maybe for female than men. Doing nutrition is mainly for female than men. Doing dentistry is mainly for men, and so on. But for us as education, wow, and with the public and other sectors, gender, means of gender, and so on, we have now taken on a strategy to see that we encourage all students, regardless of their gender, to study whatever they feel like. And we, in the ministry, we have a department for counseling and guidance. So we go in the schools and we tell them those opportunities. And if you want to be a clinical officer, you have to study ABCD. If you want to be a medical doctor, you have to study ABCD. If you want to be a nurse, you study this. If you want to be an orthopedic officer, you study ABCD.
Does that mean they are given some kind of career guidance?
Yes, that's career guidance. That's what we provide. That's what we provide. And even when they go through the first training, we continuously continue talking to them and encouraging them to take on all the programs.
Yeah. And also this last academic year, you have encountered an issue of malpractices. Yes. What kind of malpractices are we talking about, and how do you handle such a situation?
I just wanted to make a comment before we go to malpractice on the gender, that at least with the allied health profession, we are seeing progression, steady progression on the efforts we are making to encourage them. Last time we had 37, now we are at 39%, and that improvement is appreciated. For malpractice, again, this is an issue that we need to tell, especially health workers, because when you are managing a patient, you cannot tell somebody that, no, I have to do this. You have to know. If it is examination of the body, you must know to examine that body. Much as you can consult others, but we want you to be confident enough as an individual to perform. And for us as education, we totally condemn the practice of examination malpractice. We want to encourage our students to do work, to read, to do things practically, and they will know. Once you go in the clinical areas, in the hospitals, in the wards, in the field, you'll be able to know what they are going to ask you, and therefore you'll not be tempted. Because as educationists, we have appreciated that this syndrome of malpractice comes in when somebody is not ready. When you are not ready, then you start panicking. So we have advised the tutors and the principals to ensure that the students cover adequate content and practice before they are presented for examinations. And they are counseled, they are encouraged, and they are guided.
I heard the minister talk about punishment for malpractices. Are there any kind of punishments that are really given?
Yeah. You know, malpractice can be at various levels. Malpractice can be at student level. Malpractice can be at school level. So whatever level that it is on, like for students now, the exams have been cancelled. So that means that they are not qualifying with the rest of the students. That's a big punishment. They have to redo those papers. That's a big punishment. Yeah. But if it is at institutional level, even in the counseling of the student, by the way, to affect the institution, but if it is at the institution and the tutors and the principals are involved, they can be brought for disciplinary action. They can be reprimanded for whatever they have done. So the punishment, it depends on how and who has committed it. then they will be. Like in the Ministry of Education, we have the Rewards and Sanction Committee. For people who behave contrary to the set standards are always brought for such a sanction.
Okay, well, thank you very much, Dr. Safina.
Thank you.
Yes,
Thank
nice
you very
having you on the
much.
show.
Nice being with you, Victoria, and thank you for giving us the opportunity. And we do appreciate always UBC, because UBC always cover our work, and we are committed to serve our country.
During the release of the final results of the Uganda Allied Health Examination Board, Dr. Jesse Muyingo, the State Minister for Higher Education, tasked the Permanent Secretary, Ministry of Education and Sports, to train and recruit more tutors. Here is his speech.
I want to congratulate the chairperson of your HEP, Madam Nassali, and your team. So far, so good. They have started in the right gear, isn't it? I was moving around, I saw very beautiful work. I've checked the records, I've checked many things. There's a lot of great work that this team is doing. I want to thank you and please congratulations. My brothers Aisu, I'm very proud of what you did. We are celebrating all this because you took off time to think and plan for this institution. I want to thank you and pray that God blesses you abundantly. Back to the statement of release. I've noted from the statement of release that 27,891 candidates were examined by your HEP between April and June, where 20,716 were continuing students, which is about 74%, and 7,175 were finalists. When I compared the numbers with the previous year, I think we have good reason to smile that more people are getting interested in what we are doing in our institutions. I take note and appreciate the general increase of the numbers of candidates by 1,169, which is about 19.5%. And I'm very pleased with the increase of female candidates. You know, we've been complaining, why men all the time? This time they have moved from 37.5% to 39%. Congratulations, ladies. And we have good reason to clap. This is really very commendable, although in the spirit of equitable access to education, more efforts are still needed to attract more and more female students into this profession. The Ministry of Education and Sports, of course, you are aware, it emphasizes equal opportunity, equitable access to education, access to skill development for Ugandans. Therefore, more female students should take up allied health programs, according to us. We want more of you on board. The statement also indicated that 5,682, which is about 79.2% of the finalists, 7,175 finalist candidates passed the examinations. When he was presenting, he was saying that there was a drop. When the executive director was saying there was a drop, for me, I look at the numbers. Those percentages confuse me, and you will excuse me. When I saw the numbers going up, I felt very good. What about you? Don't you think so? This is a good achievement for the Human Capital Development Program. This has added more competent health workers to the existing workforce for the health sector. These health workers will ensure a healthy Ugandan population. Hence, our productivity should also go up. In the release statement, a decline in performance, especially in the practical papers, has been reported, which was attributed to limited numbers of tutors and inadequate management of practical training logbooks. or use of local books. It was further reported that some programs like pharmacy, medical records, clinical medicine and community health, medical laboratory, have a problem with their curricula. Their curricula is due for revision. I take this very seriously, but the good news is we've already started on the process of reviewing that curriculum. I'm asking the permanent secretary, who is represented by the director, represented by the commissioner, who also represented. I want to look at these titles. She's commissioner, director today, PS today, she's Nalongo, she's Hajati. I'm directing you. Please intervene so that we move faster. I know you're already doing something, as you have said. I want this review of curriculum to be concluded as fast as yesterday. I want you to intervene by training and recruiting more tutors. I want you to revise and update the health curricula in alignment with the competency-based education and training. And of course, I expect more monitoring of the curriculum, the new curriculum implementation, especially when it comes to those monitoring what goes on in the logbook. Principles, I hope you took seriously what the commissioner said. You should always find time to look at those books. All the time, at least once every week. I've also observed that with satisfaction, the ongoing construction of the UAHEB office block, which is almost complete. I've already congratulated the board for managing the public resources very well. And I hope and I pray that everything should be done so that next time we come back, we come here to commission. I sincerely thank all stakeholders, especially the parents of these people, guardians, the teaching staff. Thank you for the contribution that made what we are celebrating today. I want to commend the supervisors, mentors, all those that are helping in the training of our younger people to acquire the badly needed skills. I congratulate all the successful candidates upon the completion of your studies. And I also congratulate the parents as well for their, and thank them for their tireless efforts. I want to encourage all successful candidates, immediately you get your results, register with the Allied Health Professional Council and start working immediately. The reason is very simple. Your skills are badly needed out there. Ugandans need you to start work. Don't go before you are registered. It's very important that you have a license. I also instruct candidates who still have retakes to report to their institutions immediately, not later than 18th of October 2022, so that you complete your studies and join the others in taking care of the Ugandan lives. Something I've not liked, and I will feel bad whenever I hear it, and I feel like going out to box and fight with all the students and their lecturers, is getting involved in examination malpractice. I don't want it, I hate it, and I want you to hate it. This time they have reported those numbers you had. Those numbers, I wish those ones who are involved had not been born. Because it's a shame that this thing is happening. So I want, when he was presenting, he was asking me to guide them. I just want to confirm what the board recommended. I want to agree with all the measures to ensure compliance with the set examination rules and regulations of the board. And I therefore approve the board's decision to cancel and nullify I agree with the nullification of the said results of candidates of examination malpractices. Because I feel this is the only way we will ensure assessment for quality health. We should not compromise our standards. But I'm asking the council also to get interested in what happens not only to the students, but even the lecturers who are supposed to be supervising this exercise. When you hear very funny stories. You heard when the executive secretary was reporting that they hide the materials, unauthorized materials, where you cannot even, you use the word touch. Why do you send supervisors to supervise when there are certain areas they cannot touch? People. This time we are punishing the students who are involved, but I think that should it continue happening, we should also go for the supervisors. Don't you think so, people? Yes. Now that you have agreed with me, allow me to officially release the June 2022 final semester examination results of Uganda Allied Health Examination Board to the public.
Incredible conversations and interactions with some of the board members of the Uganda Allied Health Examination Board, and there was a lot of information they shared with us stemming from background, history, the results and performance of the students, and of course their future plans. And to all the students and candidates that pass their examinations, we wish you success and we hope that you put what you learned into practice. But that is all we had on the Education Forum today. My name is Amuge Victoria. Until next time, bye-bye.